Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Stephen Newmark, Chief Policy Officer at the Global Healthy Living Foundation. Our goal is to help you understand what's happening in the healthcare world to help you make informed decisions to live your best life. If you've been watching Congress and wondering what exactly is the difference between rescission and reconciliation and why does this matter for health policy or what the heck is going on generally with our budget, this is the episode for you. We're taking a clear-eyed look at two tools Congress uses to shape federal policy and federal spending and why President Trump's recent $9.4 billion rescission request brought those terms back into the spotlight. Let's break it down. First up, budget reconciliation. Budget reconciliation is how they passed the major spending bill earlier in the month of July. If this sounds wonky, that's because it is by design. The process was created in the 1974 Congressional Budget and Impoundment Control Act, the same law that tried to wrest back congressional control over federal spending from the executive branch. Bear with me, it's not going to be that dry of an episode, I promise you. Reconciliation starts with a budget resolution, basically a non-binding blueprint passed by both the House and the Senate that lays out Congress's fiscal goals for the coming year. It's not a law and it doesn't go to the president. Think of it as a statement of intent. Here's how much we want to spend and how much we want to tax. But here's the kicker. If that resolution includes reconciliation instructions, certain committees are tasked with changing laws to align with those fiscal targets. This mostly involves taxes and mandatory spending. Things like Medicare, Medicaid, Social Security, and other entitlements. What's powerful about reconciliation is that it allows legislation to pass in the Senate with a simple majority. No filibuster required, no 60-vote threshold. That's why it's often used for big-ticket partisan priorities. Remember the 2017 GOP tax cuts? That was done via reconciliation. Same with parts of the Affordable Care Act and also efforts to repeal it. Now let's pivot to rescission. Where reconciliation is about shaping future spending, rescission is about canceling already approved spending. In the word, rescission, to rescind. Under the same 1974 law, the president can propose to rescind or cancel specific appropriations that Congress has already passed. When that happens, Congress has 45 days to approve the president's request. Otherwise, that money must be spent as originally appropriated. It's a check, but not a veto power. Congress has to agree to the request. In late May, President Trump submitted a $9.4 billion rescission request to Congress. That's significant and very rare. Presidents don't often use rescission aggressively because Congress tends to guard its spending power closely. This request targeted unspent funds, and while the administration framed it as fiscal responsibility, critics argued that rescinding these funds could impact programs that still needed the money, including disaster relief, foreign aid, and other initiatives. The clawbacks recently passed by Congress focused mainly on public broadcasting, NPR and PBS, and also on foreign aid. So why should health advocates care about these two procedural tools? Because both reconciliation and rescission can have huge ripple effects on healthcare funding, especially Medicare, Medicaid, and public health programs. For example, reconciliation has been used to attempt cuts to Medicaid or cap federal health spending. Rescission can claw back unspent health program funds, which could slow or undermine public health initiatives. It can also be used to claw back funding for international health programs around the globe that could have an impact here in the United States. And when the budget resolution itself, the framework behind this, prioritizes deficit reduction or tax cuts over social spending, you can bet that health programs will feel a squeeze. That's why understanding these tools isn't just for budget nerds like me, it's for anyone who cares about health equity, social safety nets, or federal support programs for patients. So what just happened in Congress and what's next? Well, we've covered reconciliation and when we spoke about the big, beautiful bill, the BBB, which passed earlier in the month of July, as I previously alluded to. More recently, President Trump's rescission request is the latest salvo in a broader debate about federal spending. At the same time, however, reconciliation remains a powerful tool waiting in the wings for any political party that controls Congress and the White House. With the 2025 budget process underway, we'll be watching closely to see whether Congress issues new reconciliation instructions and for what priorities. Also, overall, as a policy matter, this is not how we should want policy to be made. We should be seeking deliberative attempts at forming majority opinions, not rushed policy choices that could lead to regrets down the road. On rescission, the use of this tool completely disincentivizes the opposition party from negotiating fiscal bills. What is the point if a majority can just rescind that funding later? Imagine, for example, the Democrats negotiating with the Republicans now on a future piece of legislation that involves spending. How can Democrats trust that once the bill is passed, Republicans won't just turn around and rescind the funding later down the road? There is almost no incentive to negotiate on future spending for a minority party if the use of rescission becomes widespread. If health advocates like us aren't involved in these conversations, funding for critical programs could quietly vanish, either through legislative maneuvering or executive rescission. Before we wrap, let's zoom out for a moment to understand where reconciliation and rescission sit within the broader federal budget process, because frankly, they're not really even the main event. The standard process for funding the government starts with the president's annual budget request, which is basically a wish list of his priorities. Then Congress responds with a budget resolution, which sets overall spending targets but does not have the force of law. That resolution frames the work of the upcoming appropriations bills, each funding different parts of the government from the Pentagon to public health programs. That's the regular order, but let's be honest, it rarely runs on schedule. That's where tools like reconciliation and rescission come in. As I said, reconciliation lets Congress change existing laws around mandatory spending in things like Medicare, Medicaid to align with a budget resolution, and it bypasses the need for 60 votes and bypasses a Senate filibuster altogether. It's a policy shaping tool, but it's not supposed to fund the government directly. Rescission, on the other hand, is technically an executive tool. It lets the president propose canceling already approved upon spending, but only if Congress agrees within 45 days. Both tools operate outside the normal appropriations process, which is why they can be fast, partisan, or controversial. But they're no substitute for Congress doing its job, funding the government on time through proper debate with a full view on national priorities. We'll keep monitoring these processes because the more you understand about the budget, the more effective you can be as an advocate. Thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you found this episode helpful, please leave us a rating or review and share it with someone who cares about healthcare policy. And be sure to follow us wherever you get your podcasts. You can find all of GHLF's podcasts at ghlf.org/listen. I'm Stephen Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.